Diabetes is not just the blood sugar control. The diabetes is beyond the sugar controls. Yes, the most important aspect is good sugar control, as diabetes can lead to several complications, which includes coronary artery disease or heart disease, stroke or cerebral vascular disease, eye disease, kidney complications, nerve complications, erection difficulties, and several other related complications. So, as part of diabetes management, just checking blood sugar at home or few random blood sugars at lab won't help you or won't help us. So we need to manage diabetes by looking actively for any complications related to diabetes and obviously looking at the sugar control. Now once we look into the diabetes control, the most important aspect is what we call as glycated HbA1c, hemoglobin A1c, which tells us the last 3 months sugar control test. And it should be done at least quarterly, at least 3 to 4 times a year, depending upon how much your doctors ask for it. The way it works that your red blood cells are surrounded by glucose, and the average red cells last for around 2 to 3 months time. So the lab would be able to tell us that how your sugar control have been over the last 3 months time. The next aspect of sugar management is your home blood sugar monitoring test. We also call it SMBG, which you can do at glucometers at home. Now, how frequently your glucometer should be done and how often it should be done would be decided by the doctor. Besides HbA1c or glycated hemoglobin A1c, or we also call it A1c, we can do self-monitoring of glucose at home. This would also help you to test know your sugar reading at home. It would also help us to monitor and titrate treatment. There are other several tests that we should be doing in diabetes, which includes microalbumin urine test that tells about any early marker of kidney disease. Along with that, a kidney function test, because diabetes can affect your kidneys in large number of population. Liver function test, because most people who are diabetes are obese and they can also have fatty liver. People should also have annual thyroid function test, if not full profile, but at least TSH. People should also get their urine routine test. Besides these routine tests, you also require an annual retinal test on a regular basis and your feet examination at least annually on a regular basis. In patients with diabetes, it's very common to have coronary artery disease, and one of the risk factors beyond diabetes is lipids profile as well. So it's very important to get the lipid profile checked on a regular basis, at least annually, on annual basis. The other aspect of test which you should be also doing on a regular basis is ECG on annual basis. Some people who have higher cardiovascular risk factors would require a treadmill test. We also have nerve testing, which can also test your damage of your nerve, or especially on your feet, by several machines, by the QST or biothesiometers or a nerve conduction studies, which we have available at all the Max centers and at different facilities of Max hospitals. The overall management of diabetes beyond sugar control, besides the oral medication and insulin, is also an excellent blood pressure control. And most people may have hypertension along with diabetes, and they would require certain class of medications. We also call ACE inhibitors or ARBs. They will end usually with a Pril or Sartans, and it should be used in a maximum dose to prevent kidney damage, to have a positive effect on your heart, besides controlling the blood pressure. A lot of people will have problem with their lipids or cholesterol, and that would require lifestyle changes, diet modifications. But we also know that statins group of medications go beyond bringing the sugar, beyond the lipid controls, and prevent the risk of strokes and heart disease, and a positive impact on your eyes and kidneys as well. So diabetes is not the sugar control. So good blood pressure controls by using of certain blood pressure medications, by using of statins group of medications, and certain class of people who have higher risk of heart disease would also require